Thank you very much. It's a very good question, and I think today endovascular treatment is the center of the stroke management, if we can say. Patients with proximal occlusions will benefit from the endovascular treatment. This is the first line, it's evidence-based medicine. And now we have to organize our systems outside the hospital to bring the patient as quick as possible to the hospital that can offer that treatment, and inside the hospital to bring the patient as quick as possible to the angio room. And we observed, analyzing the data of the 5 randomized controlled trials, that we still lose a lot of time centering the care of the patient into the emergency room and doing the imaging there, and then further transferring the patient to the angio room. So now the companies realize that, the imaging companies, and particularly Philips, has been working with us in Toronto and in a couple of other centers worldwide to make the angio room adapted, ergonomic, and ready to select the patients once they come with a stroke directly to the angiosuite. We can still treat patients late, but we will not treat all patients late. Time, it's brain. And on the workflow, on the chain of stroke treatment, I think we should try to save time as maximum as we can to then offer a better outcome. Every 15 minutes we lose a lot in terms of chances of giving the normal life back to the patient. So a couple of studies demonstrated that moving the patient, the imaging to the angio suite, we will gain up to 40 minutes inside the hospital workflow. The intra-facility transfer takes a lot of time. You have to go and you move a patient from one bed to another equipment, move it back, and usually the departments are in different buildings or in different floors. So all that makes the treatment even later than it should be. So 40 minutes is a lot. 40 minutes for a patient that has no collateral, it's sometimes all the chances that the patient will have to recover functionality. So this is why I think we invested in this idea when Philips approached us to start doing this project. And I think it's quite promising. And after the presentation, I saw a lot of interest from the colleagues on the development of this new workflow. Now that we demonstrated the benefit of the treatment, now different groups, and also in our institution, we work on patient education and stroke prevention, and we work on the network development. So I showed on the presentation a patient that came in from a city 2 hours north from us, so we had to train them having the same imaging protocols, and we had to establish transfer protocols and emergency call for those hospitals. We are now in a phase where we want to see how can this workflow be improved inside the hospital. And this is why this one-stop shop concept, one-stop stroke management, is something that is on top of the discussion on the gain time, improvement of workflow, on the organization side. That is now what is being done and has to be done in the future as well. So I think that we are still at the beginning of the use of artificial intelligence in medicine. We particularly have been using on aneurysm risk assessment to analyze the geometries, and there are some studies being done on interpretation of patients with acute stroke, and also identifying the maps and early ischemic changes with pretty good sensitivity. So I think artificial intelligence will be more and more integrated into imaging and in medicine. And I think all that will just be beneficial for us and for the patients in the future.
And certainly will increase this idea of speed and efficiency.
Definitely, because Nowadays, the stroke management, it requires still a lot of people, a lot of trained people, experienced physicians and teams. And with artificial intelligence, you can have the same quality of experience interpretation in the future, hopefully in remote sites, so we can better select the patients that might benefit of a treatment and improve the transferring of the patients without the need of connecting and asking for an expert opinion all the time if you have an artificial intelligence software that can analyze the image and give you the responses.